So someone wanted to know about optic nerve avulsion. And so avulsion means the optic nerve's been torn off the back of the eye. So here's the globe and here's the optic nerve. So in blunt or penetrating trauma, the eyeball can get torqued, or the force wave can be sufficient that it breaks off the back of the eye nerve. And because this point right here is weak, the reason it's weak is the lamina cribosa is a lamina, which means it's very thin. It's also cribosa because it has holes in it. And because there's no myelin and very little connective tissues there, and there's no supporting bone there, a traumatic force can lead to avulsion. And what that means is the nerve itself will be detached from the globe. It could be a partial avulsion where it comes off partially, or a complete avulsion like this. And so when you look in the back of the eye, normally you see the optic nerve and the blood vessels coming out of it. In an avulsion, there'll be a black hole where the optic nerve used to be, and all the blood will radiate out from there. So it'll be a black circle with peripapillary hemorrhages extending out like petals in a flower. If it's a partial avulsion, you might not see the black hole there. The reason it's important to recognize optic nerve avulsion is patients with traumatic optic neuropathy sometimes are offered treatment like corticosteroids or surgery, and the prognosis, of course, if the nerve is avulsed, is terrible, and steroids won't help it and surgery won't help it. So you can't just go in there and stick it back on because you cannot refix the axons. So optic nerve avulsion, tearing off at the lamina cribosa, partial or complete, little black hole, peripapillary hemorrhages extending out in a radial fashion. In cases of trauma, steroids won't help, surgery won't help, prognosis poor.